Do you know that 1 out of 2 women would likely have bone weakening, which is called osteoporosis, as they advance in age? Do you also know that 1 out of 3 women, by the time they get to their midlife in their 50s, they are likely to have breakage of their bones? And 1 out of 2 women who sustain hip fracture will never have their hip bone go back to its pre-functional state. Sadly, but that's true. It can be you, it can be me, it can be any woman. So this is a wake-up call for us to start paying more attention to what is beyond the surface that we see. Our skin, our body, but look more inwards to think about our bone health. And I've said it over and over again that our bone health is a very important aspect of women's health even as we age. Now, what happens during menopause? If you've been following my post, you would really appreciate the fact that I've said that our bones are metabolically active organs. So by the time we are getting to 40, we have 1% of our eggs left. And these eggs have follicles around it which produce hormones, our female hormones. And these female hormones begins to depreciate as we increase in age. By the time we are even menopausal, we don't even have those hormones produced. Now, interestingly, our female hormones, specifically the estrogen, which is the culprit, protects our bones. So they service our bones. So it's so clear that by the time we are losing our estrogens, we begin to lose our bone strength. So what can you do? It's very simple. I always talk about the simplest tips because really, I did even tell you that if you compare yourself to your male counterparts, you find out that women are at risk of having deficiencies of vitamin D, which helps to sustain our bones. We're also at risk of having osteoporosis compared to our male counterparts. So that's why you really have to start work now. As simple as it is, getting sunlight, safe sun exposure, because evidence has proven that over 1 billion of the world's population are vitamin D deficient. What does vitamin D do? Vitamin D is a very important micronutrient that helps to increase the absorption of calcium from your blood into your bones. So when you are intentionally taking vitamin D, either through diet, through supplements, and through simply sunlight, so get under the sun, you spend 10 to 20 minutes under the sunlight. That is a safe sun exposure around 8 to 10 a.m. And then if you're so worried about your skin, you could use a sunscreen, you could use a sunshade, but you are increasing the production of vitamin D in your body. So when you get a safe sun exposure and you're able to get more vitamin D, you're increasing the calcium in your bones and you're increasing your bone strength. What's the aim? The aim is for us to be more independent as we age. So if you want to be more independent, if you want to be less frail as you age, then the time to start work is now. So in summary, the word for today is for us to intentionally prevent osteoporosis. And one way to do that is for you to get vitamin D more frequently, safe sun exposure, take calcium fortified diet. So do not wait until you begin to lose bone strength, because bone diseases are silent diseases. They do not give you any sign. You just have to have a fall or a bump and then you find out that you've sustained a fracture. So don't wait until you sustain a fracture. Just start now to prevent bone loss. I hope you've learned something for today. For more content about our bone health, about women's health, about menopause, about fertility, follow at Women's Health with Dr. Noni for more tips. Take care. Bye.